The best time of year to get a flu vaccination jab is in October. This article has been reprinted from the NHS Choices website. Flu, influenza, is a highly infectious illness that spreads rapidly through coughs and sneezes of people who are carrying the virus. Flu symptoms hit quite suddenly and severely. They usually include fever, chills, headaches, and aching muscles. You can often get a cough and a sore throat. Because flu is caused by viruses and not bacteria, antibiotics won't treat it. Anyone can get flu, but it can be more serious for people aged 65 or over, people of any age, including babies over 6 months old, with a serious medical condition. If you're in one of these two groups, you're more vulnerable to the effects of flu, even if you're fit and healthy, and could develop more serious illnesses such as bronchitis and pneumonia, which could result in hospitalisation. Flu can also make any existing medical condition worse. The best time of the year to get a flu vaccination is in October. It's free and it's effective against the latest flu virus strains. Even if you've already had a flu jab in previous years, you need another one this year. The flu jab only protects you for 1 year. This is because the viruses that cause flu are always changing. Flu this winter will be different from flu last winter, so the vaccine will be different from last year's. The H1N1 virus that caused the swine flu pandemic last year will still be around this winter, so this year's 2010 to 2011 seasonal flu vaccination will include a vaccine to protect against this virus. If you think you need a flu vaccination, check with your local pharmacist, GP or the practice nurse. If a nurse visits you regularly, ask them. Most GP surgeries arrange vaccination sessions in the autumn. See your GP about the flu jab if you're 65 or over, or if you have any of the following problems, however old you are. A serious heart or chest complaint, including asthma, serious kidney disease, diabetes, lowered immunity due to disease or treatment such as steroid medication or cancer treatment, and if you've ever had a stroke. Your GP may advise you to have a flu jab if you have serious liver disease, multiple sclerosis, or another degenerative disease of the central nervous system. This winter, the seasonal flu vaccine is being offered to all pregnant women. This is because the swine flu H1N1 virus will still be circulating this winter, and pregnant women who catch this strain are at an increased risk of severe disease and flu-related hospital admissions. However, if you are pregnant and you've already had the swine flu vaccination, you do not need the seasonal flu vaccination. If you're pregnant and in any of the clinical risk groups, you should still have your seasonal flu vaccine as well. Talk to your GP or midwife if you're unsure about what vaccination you should have. When you see your GP for a seasonal flu jab, ask whether you also need the pneumo jab to protect you against some forms of pneumococcal infection. It's available to everyone aged 65 or over and for younger people with some serious medical conditions. If you're the parent of a child over the age of 6 months with a long-term condition, speak to your GP about the flu jab. Your child's condition may get worse if they catch the flu. If you're the carer of an elderly or disabled person, make sure they've had their flu jab. As a carer, you could be eligible for a flu jab too. Ask your GP for advice or go to Carers Direct for more information. No vaccine is 100% effective. Most people who've had the flu jab won't get flu. If you do get flu, despite having the jab, it will probably be milder than if you hadn't been vaccinated. The flu jab doesn't cause flu as it doesn't contain any of the virus. However, you may experience side effects after having the jab, such as a slight temperature and aching muscles for a couple of days afterwards. Your arm may feel a bit sore at the site where you were injected, and more severe reactions are rare. The flu vaccine only protects against flu, not from other viruses such as the common cold. People get vaccinated against flu because it's generally more serious than other viruses that are around during winter. You should not be given the flu vaccination if you have a serious allergy to hen's eggs or if you've had a serious reaction to a flu vaccination before. Speak to your GP. For more information and to see a video, you can go to the following website: www.nhs.uk/livewell/winterhealth/pages/flu and the flu vaccine.